We would not be here today were not for the courage and indomitable spirit of a little boy named Edward. And his strength of character, in my opinion, touched so many people that in his memory, we've tried to engage in a continuous celebration of his life by helping others. And this dedication today is a continuation of that celebration of Edward's life, and it stands as proof that the youngest and the smallest of us can make a real difference.
The Leahy Clinic provides a wide range of primary care services, including routine physical exams,
treatment for hypertension, diabetes, coughs and colds,
physical therapy,
PT, OT, counseling,
vision services,
to Lackawanna County residents who are uninsured. I believe that the clinic plays a vital role in our community, since we are the only free clinic in Lackawanna County.
We aim to provide longitudinal care for our patients, to provide a sort of medical home so that our patients can expect to have care for their chronic conditions indefinitely, and also to obtain the preventative care measures that every patient should obtain. Our goal is to make better health easier for our patients in the community.
The beautiful thing about this clinic is it provides health equity for people that don't have access to health care.
It's great for our school community and then the local community. It's a great resource for people that don't have health insurance.
We were looking for a place who accepts people who doesn't have insurance. And one of my friends told me about the clinic. Since then, I'm always here, and I mean, it's a great place.
The Leahy Clinic also has the ability to provide assistance in many different languages, which makes the care much more comprehensive, and the patient can be sure that they would be understood, not just linguistically, but also culturally.
Reopening the clinic has come at a very advantageous time. It is an opportunity for the university and Geisinger Commonwealth to really engage in core personalis.
We provide a very welcoming and respectful environment for the patients. When they come to the clinic, they feel that their needs are heard, so they trust on the care that we provide to them.
As soon as you walk in, you will feel the welcoming. You will feel like family. There's always someone here to help you.
It provides an opportunity for our students to have that experiential learning and help them develop in whatever profession they're moving forward in.
You get to see beyond the hospital, and you get to see truly what your community is faced with. So I do think that it was a very important aspect of my nursing education.
We have medical students that volunteer, nursing students, physical therapy students, even students working in the office. It's a phenomenal experience.
One of my roles here has been helping with setting up the dispensary and also volunteering to see some of the patients in the clinic.
I am the volunteer coordinator here. I help manage and make the schedules for our current volunteers.
Being around young people, especially people who wants to be a doctor and see all the emotion that they have, it's a good environment and I love it.
One of my favorite things to do is to get to know the patient. We get to see and find out what's wrong, and then we give a solution that is both manageable and affordable. Their entire demeanor changes. They come in and their face is scrunched because of pain, doubt, maybe a little fear. And then when we give them that solution, their face brightens up. They kind of get that sparkle of joy again. You know, the relief that they did the right thing. It's almost like the weight has been brought off of them. It's an unbeatable feeling, and it's a remarkable thing that happens every time.
They get to interact with interdisciplinary healthcare team members, nurses, physical therapists, physicians. They get to see the whole thing in action.
I really enjoyed how the health team came together to develop a plan of care for the patient. We talked about all the signs and symptoms that we were seeing, lifestyle changes. It was nice to develop what would be most beneficial for them.
When all the patients come, the doctors are here, medical students are here, nursing students here, all the volunteers are here. And it's really cool to see everyone focus on the main goal of helping others.
Our profession is one of service. You can't be an effective physician who has quality relationships with your patients without understanding that we are here to serve our patients. And the best way to learn that is to start doing that early and to start doing that for patients who may not have access to healthcare otherwise. And this is the perfect place to do so.
Our clinic is run by a small team of students. They are graduate assistants who manage all of the functions of the clinic. They do all of the scheduling, they do all of the peer mentorship groups, they set up all the supervisors, order equipment, things of that nature. So they are literally running the entire clinic with just some oversight from me. This is really the embodiment of our Jesuit identity, where students really have a chance to serve for and with others.
I've had the opportunity to supervise students in the Leahy Clinic since its inception. It gives students an opportunity to really grow their skills. They come in as novices and they're leaving with more confidence as true professionals. It's been wonderful to be able to witness that growth.
In essence, it's how I got my start in the work that I do. I learned an awful lot about diversity and inclusion. I learned what it means to be respectful and kind and care for the whole person. I learned a great deal of professionalism, and that teaching that I received also helped me to become a better supervisor and teacher throughout my career.
Mental health is a tricky thing. People don't necessarily want to seek services, but when they do and they start to develop coping mechanisms, people start to claim their life back. It's just a wonderful thing that the Leahy Clinic has been able to service the community as well as students at the same time.
I will be hopefully volunteering at the Leahy Clinic for my practicum experience next year. Being able to help in the same community that I live in is just a really, really great opportunity that not a lot of other schools offer.
So the Low Vision Clinic is a free clinic that's offered to older adults with a visual impairment. You get a referral from your eye doctor, an optometrist, or an ophthalmologist to come in, and we do an evaluation to look at how your vision affects your everyday life. So when you come in, we'll have you bring in your eyeglasses that you currently use, any magnifiers that you use, and typically I work with folks that have macular degeneration, glaucoma, cataracts, or diabetic retinopathy. A lot of the times the clients have lost hope, and when they leave, they have a lot of hope that they can do things, and I get lots of hugs.
Every week there's something really wonderful that happens down here. So time and time again I come down and I see students trying something that maybe they just learned, or trying something that maybe they got some experience with in the clinic previously and they really want to fine-tune their skills. Even better than that is watching them help each other. So I can help students in the classroom, other faculty can help students in the classroom, but to see them helping each other and helping each other on actual members of our community is really a special opportunity.
Recently in Scranton, we've been getting a lot of new people who have come overseas, and most of them don't have insurance. And it's a great place for them to come and get the health care they need.
What the clinic has to offer and what you might have to offer to the clinic are unique experiences that you can help communicate to other people.
Developing relationships with patients, reaching out to them, and getting their preventative care needs met is what ends up giving great patient outcomes. So when I found out that that was a need that wasn't really being met yet at the clinic, I knew that myself and some of my colleagues were best fit to try and figure out the logistics of that program and get it started here.
We have a very limited exposure to real patients in the preclinical setting, and so just by being here we've learned a lot about different kinds of patients and different needs that need to be addressed. It's really important for us to expect those differences and understand how different barriers, different socioeconomic factors can lead to different outcomes in care, and keeping those in mind will help us provide more efficient, more effective care for our patients in the long run.
I would 100% recommend volunteering at the Leahy Clinic. It's just a great way to give back to the community.
It's a great place. I love it.